I was brought up in Malawi. I lived there as a kid for from 3 to 13, and then moved back to UK and did a human geography degree, ultimately, which I took up because it was had lots of really exciting sounding courses. I didn't really have a career idea, but the courses were race and racism, international politics, local cultures, global processes, feminism. So I just went along to enjoy the courses, and indirectly I guess that's been the basis of some of my further career choices, both living in Malawi and that course. Well, my main focus at the moment in my research is governance of both health and research systems. And I think this is a really important area because it doesn't matter how good your policies are, it doesn't matter how excellent your drugs are, what interventions you design, if they don't actually get implemented and have an impact at the front line where it really matters with patients, with participants, with users, with communities, all those interventions won't have the kind of outcomes. They won't meet their potential. So the governance of health systems and of research systems is about the oversight of them and their organisation. So a lot of the work that I'm doing now focuses on that overall topic. I think it's really important to understand and to explore governance of both health systems and research systems, because if there's proper oversight, if there's proper organisation of these systems, then you have an opportunity to make a difference and to make sure that all of those interventions and ideas that people have, like drugs, like vaccines, like policies, actually meet their positive potential. So that's why I think it's important. And there are two main areas that I'm focusing on within health systems and research governance. I'm interested in how communities are involved and responded to in health delivery. So the interactions with communities. And this has become a hugely sexy topic. There's loads of money, there's loads of resources, other types of resources that are put into engaging communities. But there's very little understanding of how this can really happen in practice on the ground. And so it's a really important area to research and to make sure that the good intentions are achieved. So that's one area that I'm interested in within that overall framework of governance. The other area is that another area that's got a lot of attention is the audits, SOPs, rules and regulations within health systems and research systems that are trying to achieve better performance and more efficient services. And again, this is an area that's become so fashionable that people talk about it being a cultural movement. It's happening in so many different areas. But there's also a bit of a backlash now saying that these things can also remove people's focus. The attention can all become about form filling and making sure you're doing what your bosses and funders want you to do, and that can be damaging for what's happening at the front line in terms of your interactions with patients and communities. And so that's the other area of accountability and governance that I'm very interested in. I think it's really important to understand what's happening in reality on the ground in order to make sure that the intentions are achieved. I think it's very important to use methods that are appropriate to the question always, and often with the kind of research that I do, it's important to have a mixture of methods, so both quantitative and qualitative, a combination of interviews but also observations, because people don't always say what they think and they might not even be able to articulate what their real priorities and concerns are. So often mixed methodologies and often action research, so actually doing something to change a situation and watching and carefully documenting how that implementation unfolds and learning through doing as opposed to just learning by observing. What was interesting recently is just having a look at the newspaper headlines and seeing that in January this year there was big attention given to nurses, for example, in the NHS, and saying, are they able to focus on patient care, or are they focusing on paperwork now? And so that's not a figure, but that kind of media attention that's now being drawn to the topics that I'm very interested in is obviously interesting to me to see. The research that I'm involved in has an impact immediately for the institution that I work in. I work in an institution with 800 staff, with multiple different types of studies happening, and when we learn how we should do our research more ethically, we immediately try to implement that in our research institution. In the country, I'm involved in a technical advisory group for health systems in research in the country, so you can feed in ideas from our research in that way. And at an international level, I'm involved in various networks where we can look at how similar and different issues are in different countries, in different places, for different situations, and we can also draw on the connections that we have with decision makers at many different levels and try to make sure that our research is heard in the places where it most needs to be heard. I think for somebody thinking about research, if I draw on my own experience, what I've done all the time is try to focus on what I think is most interesting and important. And I've gone out there and tried to make the right collaborations and meet the right people who can support me to do some good quality work around it. There's no denying that it's a very challenging area, highly competitive, but that's more than compensated for, I think, by a hugely diverse job in many ways. You're never doing the same thing twice. You're always moving forwards. You're often extremely independent in your life and your thinking. You're not being given institutional ways of talking or ways of thinking. And so I guess my advice would be go with where your heart is and stick at it and build up the right collaborations to support you to get where you want to go.